Let's look at another form of communication. We call it AIDET. So this is specific to the patient encounter. So again, it's called AIDET, not EAT it, AIDET. So A starts for acknowledge, I is for introduce, D is for duration, E is for explanation, and T, of course, is for thank you. So let's go through each one. So first of all, when we're going into a patient encounter, such as going into a patient room, such as knock, 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 hi, I'm Samantha, I'm going to be your nurse today. How are you today, Miss Jones? So we're acknowledging our patient. So of course, as I've just done, make sure you introduce yourself. So this seems very rudimentary, but you can imagine when you're in the hospital, there are several people that come in and out, different scrub colors. Sometimes the patients get very confused about who's coming into the room. So it's always good to know that who's supposed to be in there is actually supposed to be in there. So make sure you introduce yourself. Next, if we're going to do a procedure or any sort of treatment, make sure you let the patient know, hey, Miss Jones, this is going to last about 5 minutes. So what that does is allow the patient to say, okay, I can do anything for 5 minutes, or man, I'm in for the long haul. So keep that in mind when you're explaining procedures to your patient. Next, let's talk about explanation. This is pivotal. If you just say, hey, Miss Jones, I'm in your room, this is going to take about 5 minutes, and then you do the treatment like stick an IV in the patient, they're not going to be very happy. So obviously make sure you thoroughly explain the procedure to the patient or any sort of treatment. The reason why we want to do that is we want to make sure the patient feels comfortable and they're informed of what's going to happen. Lastly, make sure to thank your patient. So of course, that's an understood, but say thank you for your time. I understand that was difficult or that was a painful procedure. I appreciate you cooperating with me. What that does is just acknowledging that that was an uncomfortable situation. It also helps gain rapport with your client. So now that we've talked about those steps, the acknowledge, introduce, duration, explanation, and the thank you, let's put it to a case example. Let's talk about acknowledge. Miss Jones. Hi, I'm going to be your nurse Nancy today when we introduce. This procedure is going to take about 10 minutes. And today we're going to insert a Foley catheter because you've had a hard time urinating. So we just talked about those AIDET pieces. So now let's go through the example. Such as, good morning, Miss Jones. It's me, Nurse Nancy. I'm here to insert that Foley that we spoke about earlier. Should take about 10 minutes. The insertion may be a little uncomfortable, but once it is in, the discomfort should go away. So I've been doing this for at least 11 years, so I'll make it as quick and painless as possible. So do you have any questions before we get started? And of course, after we've done this acknowledge, the introduce, we've done the duration, and we've explained the procedure, after that procedure is completed, we clearly want to make sure we thank the patient. Such as, hey, after the insertion, we should say, hey, thank you, Miss Jones, for the time and the cooperation. I know that wasn't the most comfortable procedure, but I'm sure that this is going to help us take better care for you.